Meet Afnan, a boy who loves all things sweet, candy, soda and chips. Every day, he munches on his favorite snacks without a second thought. But today, his best friend Azizul is about to discover something shocking.
Afnan, I think you got chocolate all over your face. Clean it up, man.
Who cares? Food is life, right?
Push. Afnan, your teeth, what happened to them?
Huh? What do you mean?
Your teeth are all black.
Oh no, I'm dead. My precious teeth.
Afnan, this is not normal. Eating all that sugar every day is ruining your teeth. You need to see a dentist like right now.
But what if it's hurt?
It's way better to fix it now than to let it get worse. Let's go.
A few moments later.
Welcome to Artisan Dental. Can I assist you?
Hello. My friends are eating so many junk fruits and I think his teeth are getting black. Can someone take a look?
Okay, don't worry. We can go for a checkup first. Can I get your IC?
Welcome to the Artisan Dental Clinic by Dr. Hanisa. As you enter, you will first see their registration counter. This is where patients can easily book their appointments and register for their dental checkups. Just beside the counter, they also have a selection of oral care products available for purchase. Their friendly staff is always ready to assist you. Now, let's head over to Surgery Room 2, which is the first room here on the ground floor. It's fully equipped with advanced medical equipment and a modern dental chair, ensuring a smooth and safe dental treatment experience. Moving on, they have a comfortable waiting area furnished with sofas where patients can relax. They have also added a small pantry in the corner complete with water dispenser, some light snacks, and of course, free Wi-Fi access for all their guests. Right next door, we have Surgery Room 1, also well equipped with a dental chair and all the necessary tools for high quality care. To give their patients added confidence, you will notice that they are having a certifications proudly displayed on the wall, showcasing their clinic's registration and the credential of their professional team. And that's the interior of the Artisan Dental Clinic.
Good afternoon, my name is Nur Aisha.
And I am Mama Aiman.
We are students from Kulimbar College currently studying in pre-USM program. So here with us today is Dr. Ahmad Fakhrazi Muhammad, an oral and maxillofacial surgeon who is currently working as a dentist at Artisan Dental Clinic. So doctor, can you please give us a brief introduction of yourself?
Okay, thank you very much for this opportunity. My name is Ahmad Fakhrazi Muhammad. Currently, actually, I'm a local boy from Padang Serai, and my primary school is in Permatang Todi. I guess it's on the way from you guys coming all the way from Kulim just now. And my secondary school was in Kajang, Sekolah Menengah Agama Persekutuan Kajang in Selangor, it's a boarding school. And then I got a scholarship from JPA for dentistry in Jordan back in 2007 until 2012. And I worked with Kementerian Kesihatan, Ministry of Health for 4 years before I joined USM in 2016. And in 2017, I further studied to be oral and maxillofacial surgeon in HUSM, Kelantan, for 4 years. And starting from 2021, I became an oral maxillofacial surgeon and also a lecturer in USM IPPT Bertam. And this Artisan Dental is a side business together with my wife. And currently, we do have 4 branches in Kedah and also Klang Valley.
Can you tell what does a typical day look like to you?
Being a dentist and also a lecturer, a typical day for me is, as a lecturer, we have few things to do altogether, apart from teaching, we do have research that we have to do and supervision of postgraduate students. And also, as a clinician, we have to do a clinical job, right? So in the morning, and I do have a clinical session. Usually I will start with ward round and a clinical session. And there are days where I have my operation day, operation theater session. Most of the time is Tuesday. And also, apart from that, a major thing as a lecturer is I have to do research and also teaching for the postgraduate students. And at the same time, I'm doing locum in Artisan Dental. Back after office hour, most of the time at 5 until 7, I will have to come and see patients that referred to me here in Artisan for those patients that need for oral and maxillofacial surgery attention. So I'll see them here in Artisan Dental Clinic.
So what inspired you to pursue a career in dentistry?
All right, to be honest, last time when I was in secondary school, I know nothing about dentistry at all, right? When there is a chance to apply for scholarship, my intention is to become an engineer. So I got a scholarship from MARA for chemical engineering program. And at the same time for JPA, I applied for dentistry. Those days, I'm afraid of blood. So that's why I don't apply for medical. Least to know that actually dentistry also dealing with blood. So after so much thinking, at that particular moment, and at that particular time, everybody said that for dentistry, the job is secured later compared to engineering. So that's why I choose dentistry over engineering at that particular moment. But when I start studying dentistry, I found that actually it is part of my, we call it ikigai, because dentistry is art and science together. It's not purely science. You need to have an art session. And if you are a technical guy, you like carpentering or you like, things art, something like that. So dentistry is really for you. And from that moment, I start to fall in love in dentistry when I start studying, especially during my clinical years, third year onward. And at that particular moment, I decided to become an orthodontist. I told myself that after graduation, I want to further study to become an orthodontist because I'm still afraid of blood, I'm afraid of surgery, and least to know, now I'm become oral maxillofacial surgeon. It's totally opposite of what I planned last time.
And can you describe a challenging case you have handled before?
For dentistry, not many people aware what are the specialty that present. Among them is orthodontic. Basically, people knows as the one that doing braces. We have periodontics, the specialist that in charge of gum. We have prosthodontic, the specialist that in charge of what we call it, crown, bridge, and dentures. And of course, general dentists can do all those things, but a difficult one will refer to the specialist. And of course, we have oral and maxillofacial surgeon. Oral and maxillofacial surgery is a branch or a subspecialty of dentistry where we deal mainly with any injury with maxillofacial region. So the difficult case like that, it's not a typical dentistry case. I do have a surgery. The longest surgery ever is, for me, is 21 hours. The patient is having a Crouzon syndrome, and the problem is this patient having exophthalmos, which is that the eyeball is going out of the eyeball socket, so the patient cannot close the eyes. So we do the surgery whereby we cut we call this maxilla. We bring this bone forward, and then we bring the upper jaw forward, and then we have to push the lower jaw backward. And it's a very tedious job to do and to get a very good outcome. But we start the surgery at 7 o'clock in the morning and finish suturing and everything at 4 o'clock in the morning. That was last time when I'm studying in HUSM Kelantan, and it's very tiring, but the outcome is satisfying. And definitely physically and mentally, it's very challenging at that particular moment since I'm the master student that in charge of the case. So I cannot take rest for long. You have to rest. There's like 15-20 minutes for your lunch, prayer, and then for dinner and prayer. And after that, you have to come again and assist the surgery. So that is the most difficult case that I ever deal for now.
Next question, what qualities do you think are the most important for a successful dental practice?
The most important qualities for me is attitude. I used to be a student, undergraduate student, postgraduate student. I am employee myself since I'm lecturer and working with USM. And also I'm employer myself together with my wife to hire dentists for Artisan Dental. So from these 3 points of view, most important part is attitude. We do have, I do know some of my friends or even a junior dentist, some of them are late bloomers. That means that initially we think that they are lost, but with the good and right attitude, in the end of the day, they'll be more successful than you. All right, the right attitude and perseverance is the most important thing. So I guess the most important thing to do is you need to identify yourself, identify your ikigai, whether you really like whatever courses that you take. And like, it doesn't matter dentistry or medical or pharmacist, usually what you learn during your undergraduate will reflect is what are the things that you will do later in your career. unlike others, some of them taking accounting or any other courses. In the end of the day, their job is the one that they learned before, not like us. So if you really like the course, then go for it, perseverance, and have the right attitude. For a young dentist, the most important part is you need to practice a lot and learn a lot. And nowadays, dentistry is moving quite fast with the AI and all the technologies, and you have to catch up. Last time, for example, when we want to do a denture, we do a manual impression and we do the denture manually. Now everything is digital. You can do a 3D printed, you can get denture even in a day. And even you want to do a crown and bridge, now with AI and 3D printing technologies, everything will be fast. So whatever that you learned last time, you have to relearn again now. So the right attitude and the right hunger to get the knowledge is important. That will maintain and drive you forward and to be relevant and up to date with whatever treatment that we want to give the best for our patient. All right.
What are the common dental problems you see?
To answer this, I can answer as a perspective of dentist and also perspective of an oral maxillofacial surgeon. It's quite unfair because if you want to interview me for dentistry, not for surgery, most of the patient I can see for now, for the younger generations, most of them are looking for aesthetic or cosmetic issues. So they're coming to request for braces, for example, or veneers or whitening. But for older generation, most of the time they come for dentures. But then still in Malaysia community nowadays, the awareness of dental hygiene is still not as good as maybe in developed country, whereby quite a number of patients coming in request for extraction. Even though for a dentist, we consider extraction, removing the teeth, as the last option for a treatment. But in Malaysia, sometimes you just feel pain a little bit, then you want to extract rather than save the tooth. As for surgeon, I'm currently working in IPPT, and I'm part of oral cancer research program. What we do, I see normally and almost quite every day, like not really every day, like once a week, there are referral case for tongue cancer. We are the only institution currently, at least in Southeast Asia, that doing tongue cancer treatment without removing the tongue. The normal things to do to treat the tongue cancer is by cut part of your tongue together with the margin, and also we have to do the neck dissection, meaning that we remove the lymph node on the neck, and then it depending on how much the tongue left, if it's small, then we have to do a reconstruction, meaning that we take some tissues either from your hand or from your leg to patch at the tongue area. Definitely by that treatment, that is the gold standard treatment. But some patient, after you cut away the tongue, they can't really talk normally, they can't really eat normally, and their sensation, their taste, especially sensation, won't be there for the reconstruction part of the tongue. And patient got no option, no second option all this while. But in IPPT Batam, ever since last 5 years, we discovered a technique, we call it brachytherapy, whereby we put a very high dose of radiation on the tongue, and also for the external, to treat the patient who have tongue cancer without removing the tongue. We call it tissue preservation technique, whereby after the procedure, patient can eat and can talk normally, and the success rate is quite high. As for now, 5 years data, it's still new, but I'm glad to be part of the team.
Can you give an advice to those who want to become a dentist?
For those who become a dentist, my advice is, this is a noble job. I call it evergreen, because there are some jobs that are going to be replaced by AI. Even though there are some part that might be replaced by AI in dentistry, but in order for you to see the patient, to diagnose the disease and to treat the disease, still we need human touch. And for a long period of time, dentistry will still be relevant. My advice is, if you decide to become a dentist, then just go for it. Study hard. Don't play too much during your undergraduate. Importantly is surround yourself with the right person and to have perseverance. Tell a story. Last time, I find it very challenging to me to go for specialty training. It's very much different compared to undergraduate. When you're undergraduate, you don't have any commitment. Everything is free. What you need to do is just study. During the postgraduate study, you already have family, you have commitment. Sometimes you need to have a long distance relationship, physically tiring, mentally tiring. But with the right attitude during the undergraduate, it will be your fundamental when you want to further study for your postgraduate. I guess in the future, what the country needs is more and more specialists. Because we need the ratio of how many medical doctors to the population and how many dentists to the general population. And of course, it needs the right people with the right attitude It's not the most brilliant. Believe me, not the one that most brilliant in the class will become the specialist. Not true all the time. Those who perseverance, you have the right mind, the right attitude, and you really want to go for it, is only the one that will go further in their career.
Okay, so last question of the day is, can you share your point of view regarding people who think that pursuing dentistry is much easier than medicine? Is it a myth or is it true?
That was my mentality last time. I thought dentistry is easier than medical. Least to know that there are certain schools that the first 2 years, the medical and dental students somehow they are in the same class. Whatever subject, you have to learn from head to toe. But later on, during the clinical years, only they will separate dentistry as dentistry, medical as medical. So during that period of 2 years, we call it pre-clinical year, you have to learn from head to toe. At the same time, you have to learn dentistry stuff like dental materials, the lab part of dentistry. Still, you have to learn about that. On top of that, whatever that the medical student have to learn. It is tough. Both have its own challenges. And to say that it's easier, I don't think so. It depends on what you want. And later on, when we work in hospital, we have to respect each other in terms of each specialties. For example, like as a doctor, we cannot look down to physiotherapy, for example, or speech therapy, or dietitian, because we need their advice. They know what to do with the patient. And I guess I don't think physiotherapy is easy. Every course has its own challenge. It depends on how we look at it. And not each specialty you will become richer towards the others. In the end, it's about business, it's about your attitude, and it's about the service that you offer that will determine your income and your value. So I don't really think that your income is proportionate with whatever subject or whatever course that you take. It's subject to the quality that you give to the population. Your net worth or your value depends on that. So most importantly, have the right attitude, and you are the master or the specialist of your thing, and you do it rightly, people will look for you.
Okay, so that was the last question for Dr. Fakhrouzi. Thank you so much for your time. We've had a really great time listening to your experiences and your opinions. Thank you so much.
Welcome. Thank you for giving me this opportunity. I wish you guys all the best. Perseverance. Sometimes you will meet failure in whatever exam or everything, but don't give up. There's a lot of people that they don't really start bright. Some of them, they just work as medical assistants or nurses, but with the right attitude, perseverance, some of them becoming a doctor later. So you guys have the very good chances to become a medical doctor or dentist or pharmacist. If you really think this is for you, really go for it. Life is not easy, and never give up. Right?
So sitting beside me is Dr. Nisa. Dr. Nisa, can you please share some of your experiences working with Dr. Fakhrouzi?
So the way empat. So alhamdulillah, saya sudah